Hey, good morning, boy. Am I glad to see you?
Hey, Terry.
Hey.
All right.
So I'll give you a report first on the patient in room one, Skylar Hanson. He's an 18-year-old who was brought in the emergency department in DKA in diabetic ketoacidosis 3 days ago. He's been in the ICU for 3 days, had fluid, insulins. Now he just has a saline lock in that right forearm that worked fine for us last night. His electrolytes and blood sugars have stabilized, and he's been transferred out here to us. They took his Foley out last night, and he's voided 700 during the night. The mom has been with him since admission, and she's very concerned. A little bit of his history: he really has no medical history at all. Takes no medicines. His immunizations, everything's up to date, but was beginning to have frequent urinations and fatigue over the last 2 to 3 weeks, and so that's what brought him to the ED originally. So he's new onset, and the mom, as far as she knows, he doesn't smoke or use drugs, but does admit in the last year he's come home drunk a couple of times. So, but pretty easy for me.
Has he been alert?
Yes,
And
he's
oriented?
alert and responsive.
Okay.
Just sort of overwhelmed with.
And he's outstanding, just a disposition on what they're going to do next with
Again,
him?
he's overwhelmed. A little 18-year-old that's
Okay.
overwhelmed with this new diagnosis.
We will
So,
work to help him understand what's going on as best as I can.
Okay.
Thank you.
All right. Have a
I
good day.
appreciate it.
Get
Okay.
some sleep.
Knock, knock. Hi, my
Hey.
name is Maureen. I'm going to be your nurse today.
Hey, Maureen.
How are you feeling?
Doing okay. Not too well.
I'm sorry to hear that. This all must be very strange for you.
I guess it is a little bit different.
Yeah? Well, so, I understand that your mom is with you too?
Yeah, she's somewhere out in the waiting area.
Okay. Well, I'm just going to quickly look over your chart, and feel free if there's any questions that you have about how you're feeling, or anything about what's going on with your care. I would love to answer questions that you may have. So I understand that you don't have any. Do you have any allergies?
I do not.
Okay, great. All right.
Oh, good morning, honey. They finally let me in here. I didn't think they were ever going to let me in to see you.
Good
How are you doing
morning.
this morning? Are you okay?
Doing all right.
Good morning. Good
Worried.
morning.
Good morning.
How are you?
I'm good. Are you going to take care of my baby?
Yes, I'm just checking out. There's a couple of things I think he already needs to have in place. And just so you understand what's going on, I'm going to assess you. I'm going to listen to your lungs. I'm going to, check out how you're feeling. Palpate your head, listen to your belly. And any place that you have any pain or discomfort, just let me know. I believe that you're supposed to be on oxygen based on the orders. So have you been wearing
I
oxygen?
thought they
at
took
all?
that off of him last night because he was doing good. Is he not doing good now?
Well, you seem to be talking well and answering questions well, so that gives me a lot of confidence that you're, on a good path. I'm going to be checking your blood sugar as well, because as you know, part of having a diagnosis potentially of diabetes is that we have to monitor your blood sugar levels on a regular basis. And I don't know, has anyone shown you how to do it for yourself to check your own sugar?
Once or twice, but I don't feel that comfortable with it, I guess.
Okay, all right. Well, that's something that we can work on. But
He
I
doesn't
will-
like needles.
Yeah, that's, I completely understand that. There are many people who have that kind of they understand that they're dealing with it. I'm sorry, I'm just gonna also just check your IV line here. And sadly, or positively, there are so many advances and there's so many different types of meals and stuff that we will work to figure out what works best for you. Okay? Do you have any pain here, any discomfort here?
Mm-hmm.
Okay, I will check that line in a little bit. All right, good. You want to just grab my hands real quick and squeeze? Cool. Okay, good. Good. Now, I'm going to listen to your lungs, okay? And Mom, if you've got any questions that you have, please feel free to ask. but after I listen to his lungs, if that's okay.
Okay, I'll just get your breakfast ready, sweetheart.
Oh, how about we hang on breakfast for a bit until I do a complete assessment, and then I'll help you, figure out what's best for him to eat.
Okay, well, I brought him all of his favorites.
In and out. Good. 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 Okay. Would you be so kind as to be able to sit up for me? Yeah, great. I'll get you sorted out too, okay? Breathe through me again. Good. 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 Okay, one more time, and good. Okay, you can move back. Great. Now I'm going to listen to your belly, okay? So I'm going to start by just listening for a little bit over here, okay? You can just breathe normally. You don't have to do any deep breathing now, okay? Okay. Have you been able to go to the bathroom? Tell me about you going to the bathroom.
I've been able. I did better at going last night than I have in a while.
Mm-hmm. So have you had a bowel movement?
It's mostly just peeing.
Just peeing? Okay, I'm just gonna check your legs. Just mostly peeing, okay. And you're able to get up on your own? Have you had any kind of dizziness or any kind of odd sensations?
I haven't.
Okay, good.
I'm just so glad your friends brought you to the emergency room.
Yes. I know this must be really frightening. I'm sorry, Mom, I'm gonna just...
Here you go, sweetie. I got you one of those new blueberry muffins. Look.
Oh, yeah, how about we
Look at
hold
that.
off on that only because I want to check your blood sugar first, okay?
Okay.
And then once we do that and we'll see what your numbers look like, maybe that might not be, Mom, the best food to help him get stronger,
But
to
it's,
be able to
but it's
help
his
him.
favorite,
I
and
know.
I
You
want him
know
to
what
have his
is?
favorite.
My favorite is something that my mom used to like put on my plate, and now I just can't eat it anymore because I've just kind of grown up and I found out that it's pretty unhealthy for me.